There have been quite a lot of previous studies that have shown that singing can reduce stress hormones and improve mood, including studies that we've carried out. But we wanted to know, could singing also change biomarkers of the immune system? And if so, which biomarkers, and how might this actually alter between different groups, for example, cancer patients? And the reason that all of these questions were interesting because they led to a larger question as to whether, if people sing on a regular basis, these effects might start to add up and have any kind of longitudinal psychological or biological impact. The study really seemed to capture the public's imagination, and we saw quite a lot of press coming out after it had been published. I think partly that's because lots of people like singing and like music more generally. But we deliberately didn't look at any long-term outcomes or clinical outcomes from the study, so we certainly can't make those claims from these data. But I think in terms of impact, I'm hoping that as well as taking us one step further in terms of what we know in a research perspective, that perhaps the study might have encouraged people to take part in more choirs that are connected with hospitals or cancer centres and made them more aware of the work of these charities and organisations. I think this study adds to other studies which have been carried out, looking at how activities can be added to core treatment to improve wellbeing and quality of life and reduce social isolation and loneliness, and even increase social support networks in patients and families. And I think with these additional activities, it's important that patients have choice and they can actually find things that they really enjoy. So it's nice to be able to add something like singing, hopefully, to the roster of opportunities that are available for people. This was a preliminary study, so as well as providing some exciting data, there are quite a lot of questions that have now been raised from it. So we just looked at a single 70-minute session of singing, but what we don't know is whether the effects that we found actually just went back down to baseline 20 minutes later, or whether actually, especially if people sing on a regular basis, there might be something that might start to build up over time. And we also don't at this moment know exactly what about singing it is that leads to any effects, whether it's specifically something from the music, perhaps some emotional response, or whether it's the social support that people get from being in a group setting, or whether there's some kind of relaxation response from the deep breathing and almost mindful qualities of singing. But these are things that we want to look at a lot more going forwards. So we've just started now a longitudinal controlled study where we're going to be able to hopefully identify a bit more about how singing helps and what it does. We were really keen to publish open access because, as well as reaching out to researchers and being able to take us one step forwards from a research perspective, we also wanted health professionals and arts practitioners and patients and public to know about the data, perhaps to encourage more services to be developed or to support organisations such as Tenovus in their future activity. There are lots of organisations around the world offering choirs as support within hospitals and cancer centres, including Tenovus Cancer Care. But also from a research perspective, we now have another study which is recruiting in London. So if people are interested in getting involved in that and having access to choirs as part of the research, they can visit tinyurl.com/cancer choir research.